Hello everyone. Today's video is a Q&A video talking about the long-term use of histamine receptor blockers, NAC and glutathione being used together, and also PCR testing for parasites. If you don't mind taking a quick moment to like, share, subscribe, and or post a quick comment on the video, I'd really appreciate it. So thanks in advance for taking a second to do that. And as per usual, nothing I'm saying should be construed as medical advice. This is for informational purposes only. If you need medical advice, please talk to your healthcare provider to get that advice. Sorry, I've been talking all day. End of a long day of patients. Anyways, I'll try to speak more eloquently moving forward. So the first question I have up here is, can we take glutathione and NAC together? So good question. I've posted a couple of videos about NAC and glutathione and kind of contrasting, what are they each used for? What do they each seem to help with? If you're interested in checking that out, easiest way to find that is searching my YouTube channel and seeing what's on there, keyword searching that. But I have prescribed NAC and glutathione together in many cases. And I can't give any treatment advice over social media, of course, but in my experience with my patients, I do recommend them together in many cases because they are both good at doing different things. But in my opinion, there's no contraindication there for the vast majority of patients to take them at the same time. And the next question. So let's see here. So just for context, this was a comment / question that was posted on a video that I posted about mast cell activation syndrome and histamine intolerance. And so it says here, have you ever had a case involving the routine use of antihistamines, H2 blockers or otherwise, long term? Apparently antihistamines can cause physical / mental withdrawal problems. There are hundreds of reviews on Ask a Patient for Zyrtec, which for my Canadian listeners is Reactin or cetirizine. And so anyways, hundreds of reviews on Ask a Patient on Zyrtec, Benadryl, Pepcid, all confirming this spooky stuff, perhaps due to rebound high histamine levels. Sedazy, i.e. the body overcorrects due to blocked receptors, and then when the problem compounds enough, all these horrid issues burst forth, exceeding the medication dose. I'd love to hear your thoughts on this phenomenon. So I have had patients who take antihistamines like Zyrtec / cetirizine / Reactin or Benadryl, also known as diphenhydramine, long-term because they have crazy histamine issues and they seem to need to take them long-term. Then I've had other patients who have been prescribed antihistamines by other clinicians. There are some clinicians out there and they just kind of treat everyone for MCAS / histamine issues, and they just have all their patients on, or maybe not all of them because I don't know all their patients, but the impression I get is that they put all of their patients on antihistamines, and sometimes they're on them for years and years. Generally speaking, in the short term, I don't see any notable issues with those. If a patient's going to react negatively to an antihistamine in more of a sort of like a symptom, a symptom exacerbating or new symptom provoking way, in my experience, that's usually going to become pretty obvious within a short time after they start taking it. Like within, I would say, a few days at most, or a few days, likely a week or two at most. And then in terms of any type of like a kind of like, as you're referring to here in the question here, like kind of breakthrough histamine symptoms, or like what we sometimes refer to as histamine flooding symptoms, that's something, again, that we're usually going to see within the span of a couple of weeks. I haven't seen cases where it seems like the antihistamines are going fine and then they just suddenly start causing lots of issues. Now, with that being said, in the short term, like, yes, that can definitely happen. So with the Ask a Patient website, or assume it's a website. I've never been on it before, but I assume that's what it is. There's analogous websites out there where folks kind of self-report these issues with different medications. I have no doubt that there's lots of reports on there, many people that don't report them, because I've had lots of patients who do react negatively to those, but it's not something where it's like, oh, after months or years of being on them, that's when they're reporting this. Now, maybe there are folks on this website that are specifically saying, oh, I was good on this until a couple of years later and then it caused problems. I'm not saying that's not a thing, I just haven't seen it in my practice. Also, in my practice, when I'm usually the one that's recommending the antihistamines for patients, and I generally don't have them on or ask them to be on those antihistamines for incredibly long periods of time. Now, of course, there are many people out there who are on Zyrtec/Reactin /cetirizine or other, second generation antihistamines like that for many years, because they have chronic allergies. And in a lot of cases, I think there's pretty good clinical evidence that they don't seem to have issues after being on them for a long time. Now, that being said, there was some research that came out a little while ago showing that folks who are on at least second generation antihistamines like Benadryl for long periods of time, at least in geriatric patients, that was associated with some mental decline, because there is acetylcholine antagonism, and low acetylcholine in a older brain is not good for memory and whatnot. So I always try to use antihistamines as short-term and sparingly as possible, because of course with anything, like, there's just so many unknowns. And so I think there's definitely cause for caution and trying to be judicious with their use, but that's been my experience with them up to this point. As far as H2 blockers go, I mean, of course, there was the, it was Zantac, if memory serves, where, there was some carcinogenic, link that was there with, I think, some contaminated Zantac, if I remember the story correctly. So that's obviously awful. But in terms of it being, linked to the H2 receptor blocker related function, I'm not aware of that being an issue, and I haven't seen any particular issues with that. Of course, some people go on H2 receptor blockers, which block stomach acid, and they might have indigestive symptoms, but then a lot of people, it helps their digestion. So it's I think generally that class of medication is quite well tolerated, but there, of course, are going to be some exceptions to that. So thank you for those two questions. And then the final one here is was posted on one of my other videos, which is called The Pros and Cons of PCR, aka DNA testing. Well, PCR is not a synonym for DNA, but so PCR testing, aka DNA testing for chronic infections. And so the question was, what do you think about stool PCR testing for parasites, pros and cons? So I have definitely posted another video about stool testing, so I won't kind of PCR stool testing, mostly talking about the GI map test, but there are other companies besides GI map, or what are they called? Anyways, I don't remember what the actual parent company is called, but anyways, there are other companies that do DNA testing besides the company that offers the GI map testing, and I have a whole video about that. But as far as I say in that video, but I'll say it again here, I think that PCR stool testing for parasites, that's one of the avenues that I think PCR testing is actually really helpful for stool testing. I think there's questionable benefit for looking for other types of microbes, but for parasites, I think it's really valuable, because to my understanding, a PCR test is really like, yes, no, is there DNA for this parasite in the stool sample? What it doesn't differentiate, to my understanding, is whether or not the DNA is coming from something that's alive or dead, which is why it can be really questionable as to how beneficial that is with testing, say like using PCR testing for probiotic levels or something like that in a person's body. However, for parasites, if it's something like, say a tapeworm or something like that, or a helminth or something like that, pinworms, like, they're not supposed to be there. So if you find the DNA, if one of my patients does this test and we find the DNA of, say an ascariasis parasite in their DNA sample or in their stool sample, well, that's not supposed to be there. So whether it's alive or a dead one, like, it's not supposed to be there, so that's going to be cause for alarm and motivating us to say this patient should really probably do an antiparasitic protocol. Whereas if it's like, oh, I found DNA for Candida in the stool test, it's like, well, is it live? Is it dead Candida? It doesn't really tell us anything about it, because we all have Candida in our intestinal tract, so it doesn't really give us any useful, actionable information, in my opinion. On the other hand, or I should say, to just expand a little bit further on the parasite question, there are certain parasites, like say Blastocystis hominis, which make up, to my understanding, a normal part of our intestinal ecosystem. And so if we found, say, if there was a positive PCR test for Blastocystis hominis, or maybe Entamoeba histolytica, which is also, kind of questionable as to whether or not that's an abnormal, like, kind of foreign parasite in the gut, then like that might be a little bit less useful. So it kind of depends on the parasite, but if it's a parasite that's definitely not supposed to be in the gut, I think, in my opinion, PCR testing can be really useful. So thank you for these questions. I hope this information was useful. If anybody has any questions about these topics or anything else, just post in the comment section below, and I will do my best to answer as soon as I can.